following portion of My Carolina is sponsored by...
It is imperative to take care of our bodies, especially when it comes to pregnancy. Triangle Chiropractic and Rehabilitation Center is ready to help you in that area of care. And I'm joined again by Dr. Lindsay Mumma to learn more about why taking care of our body is so necessary in that stage of life. Dr. Lindsay Mumma, welcome back to My Carolina. Thank you for being here.
Thank you so much. I'm glad to be back.
Yes, absolutely. This is always so exciting for me and, you know, all of the moms or soon-to-be moms out there who may need a little direction when it comes to this topic. So let's talk about it. Why is chiropractic care so necessary during pregnancy?
So the body changes drastically during pregnancy. There is a period of approximately 40 weeks, but that's not an expiration date. That is approximately. You are full term from 37 to 42 weeks. So there's a big gap there. But in that time period, there's so much change that happens in the body. The center of gravity changes. The way that a woman carries herself changes. And so a lot of those changes are happening within her spine. So chiropractors are working with the whole entire body, but a lot of our focus is within the spine. So as we have those postural changes and then the changes in how a woman is moving around and doing things, it's really important to make sure that there's good movement happening and that she's not missing out on the ability to be able to get into certain positions during labor. So some women will opt to maybe just have an epidural, and that's kind of the plan. And so they're like, my plan is to go to the hospital and get an epidural, and that's what I would like to do. That's great. But before you get admitted to the hospital, one of the best pain mitigating techniques that we have is movement. And so if you don't have movement available to you, then that pain mitigation technique is not available to you. So if a woman is wanting to have a birth without any intervention, then it's especially necessary that she is able to maneuver her body throughout the laboring process. And there's actually evidence that shows us that her ability to get into a full deep squat will give her a better birthing outcome than if she's not able to, even if she doesn't birth in the squatting position. So it's kind of cool.
Yeah, super cool. My best friend is actually pregnant right now. She's due next month. So I'm watching, you know, all of these changes and developments happening to her body. And so it's truly a miracle what our bodies can do. But they sometimes need a little help stretching out and being in flexibility mode and just getting prepared for that time. And you guys are absolutely able to help with this process. So let's go into what types of issues that chiropractors can help pregnant women with.
So oftentimes we'll see women who have low back pain, and that's kind of, you know, like we talked about when we were talking about postpartum rehabilitation, we think of low back pain as this rite of passage that all pregnant women are going to go through, but that's really not true. There are plenty of women who don't have pain during pregnancy.
Good to know.
Yeah, good to know, right? But there are also lots of women who are experiencing some symptoms of their body is changing so rapidly, and they're not quite keeping up with that. So maybe they are missing movement in some of their joints, and as a result, it feels more uncomfortable as they have this weight gain and they have these changes happening within their body. So some of the things that we typically will see and can help with are low back pain, pelvic pain, upper back pain as they're kind of rounding into this position. And then with that, we will also see some carpal tunnel-like symptoms. So we can help with carpal tunnel syndrome anyway, but oftentimes we get numbness and tingling in the hands and upper extremities. That's actually just related to the postural changes that are happening during pregnancy, and chiropractors are great for helping with that. So other things include some headaches, and we can also rule out if a headache is a cause for concern or if this is a musculoskeletal headache that chiropractors are always helping with.
Very cool. Okay, so is there a certain time during pregnancy that it is appropriate to start seeing a chiropractor, or from the very beginning to the end? What's the timeline like?
Do you want the snarky answer or the real answer? Okay, so the snarky answer is 3 months before you conceive.
Oh, so way
earlier. Ideally, we're seeing women before they actually become pregnant.
Gotcha.
But the next best answer would be yesterday.
Okay.
You know, and then the true answer would be we really need to focus around 25 to 32 weeks gestation, because that's when the baby is kind of getting into their optimal position.
Gotcha.
And so chiropractors aren't moving babies, but what we are doing is allowing a baby to get into the best possible position within the mother's uterus by helping the mother's system move and function well. So 25 to 32 weeks is kind of a crucial time period, but then the last couple of weeks before baby is born are incredibly crucial for making sure there's pelvic movement and making sure that the spine is moving well and making sure that the soft tissues are all really pliable and ready for birth.
So what are some other things that pregnant women can do to support their body during this time, this growth period?
So nutrition is a huge thing, movement is another huge thing, and your mindset and what we're kind of surrounding ourselves with. So when I talk about nutrition, I'm not just talking about the food that you eat, but the media that you consume and the people that you surround yourself with. Those things are really important, because if you're surrounded by uplifting and positive and helpful community, then you're going to have a better experience because you feel supported, and that makes it easier for you to go into this very unknown situation that is birth, right? This is a frightening time period for a lot of women, and the more supported that you feel, the better. Additionally, the nutrition that you do put into your body, so, you know, what I tell my patients all the time is an anti-inflammatory diet. So fruits, vegetables, meats, nuts, and fish. If you're eating those things and then just condiment sizes of anything else, you're eating a largely anti-inflammatory diet. So it's going to decrease the amount of inflammation in your body, which helps your soft tissues function well. It helps your nervous system do everything that it is already ready and willing to do. And then the other thing is movement. And so we have fitness classes at Triangle CRC because we want to support women in their journey. And then we also just want to support everybody who needs to find that movement medicine that's available.
Yeah, absolutely. Well, it all stems from each other. Things just, it all works together in a sense. So everything that you're doing is awesome. So if people are interested in learning more about you, contacting you to get some help with their pregnancy bodies, how do they do that and learn more?
So they can always go to trianglecrc.com. We have everything available there, and on social media as well. So we have blogs, we have videos, we have some online courses, and then you're just more than welcome to come by and stop in and feel what it feels like in our space, because it's really great.
Great. Awesome. Dr. Mumma, thank you for being here. We really appreciate it.
My pleasure.
The preceding was sponsored by